Hi guys, so today we will be learning about the common peroneal nerve. So common peroneal nerve എന്ന് പറയുന്നത് it's a terminal small branch of sciatic nerve. So before we go into the common peroneal nerve, we know the leg is divided into anterior, lateral and posterior compartment. So anterior compartment വരുന്ന muscles ആണ് tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius and extensor digitorum brevis. And lateral compartment വരുന്ന രണ്ട് muscles ആണ് peroneus longus and peroneus brevis. So and then we have posterior compartment. അപ്പോൾ കോമൺ പെരിനിയൽ നെർവിൻ്റെ രണ്ട് ബ്രാഞ്ചസ് ആണ് ഡീപ് പെരിനിയൽ നെർവും സൂപ്പർഫിഷ്യൽ പെരിനിയൽ നെർവും. സോ ഡീപ് പെരിനിയൽ നെർവ് ആണ് ആൻറ്റീരിയർ കമ്പാർട്ട്മെൻറ്റിൽ ടിബിയാലിസ് ആൻറ്റീരിയർ, എക്സ്റ്റെൻസർ ഹാലോസിസ് ലോങ്ങസ്, എക്സ്റ്റെൻസർ ഡിജിറ്റോറം ലോങ്ങസ്, പെറിനസ് ടെർഷ്യസ് ആൻഡ് എക്സ്റ്റെൻസർ ഡിജിറ്റോറം ബ്രെവിസിനെ സപ്ലൈ ചെയ്യുന്നത്. വൈൽ ദ സൂപ്പർഫിഷ്യൽ പെരിനിയൽ നെർവ് സപ്ലൈസ് ദ പെരോണിയസ് ലോങ്ങസ് ആൻഡ് പെരോണിയസ് ബ്രെവിസ്. Now we'll learn about the course of the common peroneal nerve. So where is common peroneal nerve forming? Common peroneal nerve is forming above the popliteal fossa, little above the popliteal fossa, at the junction of middle 1/3 and lower 1/3 of the thigh. And that it passes through the popliteal fossa and enters the leg, where it divides into at the neck of the fibula. At the neck of the fibula, it divides into, there is neck of the fibula. It divides into deep peroneal nerve and superficial peroneal nerve. So this is our superficial peroneal nerve. This is our deep peroneal nerve, and this is our superficial peroneal nerve. So as we have learned, the deep peroneal nerve will supplies the tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius, and then coming to the foot, it supplies the extensor digitorum brevis, and then it has an articular branch to the knee joint. It has an articular branch which supplies the ankle joint, and it gives sensory supply to the skin of the cleft between first and second toes. So just for representing, so this is our leg. So this is the cleft between the first and the second toe. So the skin of the cleft between the first and second toe is supplied by this deep peroneal nerve. Now coming to the other branch, superficial peroneal nerve. Superficial peroneal nerve supplies two muscles mainly, that is peroneus longus and peroneus brevis, and there is a sensory supply. The sensory supply to skin on the lateral side of the leg. And again coming to the foot, it supplies the skin of the dorsum of the foot. And in the popliteal fossa, it gives sural communicating branch, lateral sural nerve, genicular branch, and an articular branch to the superior tibiofibular joint. So this is about the peroneal nerve, that is common peroneal nerve. It gives sural communicating branch, lateral sural nerve, genicular branch and superior tibiofibular joint in the popliteal fossa. Then at the neck of fibula, it travels in front of the plantaris and lateral head of gastrocnemius, and then on reaching the neck of fibula, it divides into superficial peroneal nerve and deep peroneal nerve. Deep peroneal nerve supplies tibialis anterior, extensor hallucis longus, extensor digitorum longus and peroneus tertius, and it enters the foot, where it supplies the extensor digitorum brevis and gives sensory supply to skin of cleft between first and second toe, and it also gives a articular twig or articular branch to the ankle joint. Now about the superficial peroneal nerve, it gives supply to the lateral muscles of lateral compartment, that is peroneus longus and peroneus brevis, and to skin of the lateral side of the leg, and on reaching the foot, it gives sensory supply to skin of dorsum of the foot.